Hi everyone, my name is Amanda Stacy. This is going to be my patient today. I'd come in, introduce myself after washing my hands. I would check his ID band. This is Michael Johnson. Is that correct?
Yes, ma'am.
Can you tell me your date of birth?
3/26/95.
Can you tell me today's date?
November 1st.
Okay. Today we're going to be doing a head, neck, and neuro exam. We'll be checking the cranial nerves, nervous system, all that good stuff, okay? So today, Michael, we're going to start with the head, then we'll go to the neck, and then we're going to go to reflexes and different things, okay, cranial nerves. I would start with checking his head, checking the hair for even distribution, knots, bumps, any type of nits in the hairline. I would check his eyebrows to be evenly distributed. His hair is evenly distributed, thick, brown. His ears are symmetrical. His neck is in line. His eyes are in line. Michael, can you tell me if you have any pain? All right, I'm going to check it. All right. Do you have any tenderness in the maxillary sinuses?
No.
Okay, what about the tongue?
No.
Okay, I'm going to check the temporal pulses, noting that this is the frontal, this is the parietal, temporal, occipital. Next, we'll move on and we're going to go ahead and look at the lymph nodes, and then we'll do cranial nerves. Okay. I'm going to start with the pre-auricular, post-auricular, and just you kind of move it down in a certain motion to the tonsillar, to the submandibular, to the submental, and then I'm going to make an imaginary triangle, and we're going to be looking at the thyroid as well. Here's the thyroid, the cricoid, right under the cricoid. So just to the left, there's a sternomastoid muscle, and we're going to look on the anterior side of that muscle for the more shallow cervical lymph nodes, heading down, and then posteriorly, and then to the trapezius, and this is the clavicular, occipital. Again, noting any lymph nodes that are swollen or enlarged, and noting their size and if they're movable. All right, Michael. We're going to be we're going to do an eye exam, but first I'm going to kind of go over what cranial nerves we're going to be looking at. And there's 12 cranial nerves, and it's olfactory, the optical, the ocular. We're going to be looking at the trochlear. We're going to be looking at the trigeminal. We're going to be looking at the 7 and 8 facial muscles and hearing, and we're going to look at the vagus and the hypoglossal. We'll be having him to do a few things for us here in just a moment. So, Michael, you do not wear glasses, correct?
Correct.
All right. In this purpose of this video, we don't have a Snellen chart, but we would have him to stand 20 feet away from the wall with a Snellen chart and cover each eye and read the lowest, individually, lowest line he can read. Today, we'll go ahead and we'll do the near vision. Michael, cover your right eye and tell me the lowest line you can read.
BET.
Okay. And we would do this with both the eyes bilaterally. Again, we're going to do a eye exam, optic, but we're going to do the hearing test first. Michael, I'm going to get behind you, and I want you to tell me when you can hear me. And I want you to repeat what I say.
Baseball. 99.
Okay, I want you to tell me when you hear the sound that I'm making.
No.
Okay. All right. I'm going to have you now we're going to examine the ears, and I'm going to be looking in the ears for any type of drainage, redness, bulging. We're going to be looking at the tympanic membrane, and I'm going to use my otoscope, and I'm going to look right down, going up and out, and looking down. And I would have my light, and I would be looking, again, noticing welting or any infection to both sides. I would also I'm going to use this for the purpose of my eye exam as well. I would have Michael to look straight at the bridge of my nose. For this purpose, I don't want to get in front of you guys. And I would look into Michael's eye, examine the eye, looking at the optic disc, looking for the red, and I would go 15 inches away, and I would go in with the light and look and examine the eye. Then I want to check and see if his eyes are reactive, his pupils dilate. So I'll just look to the side, noting that they're dilating, and how quickly, and they're equal. I want to check and make sure Michael he's not tender in the ethmoid. I notice the symmetry of his nose, it is straight. Looking for polyps or any type of lesions, noting that if the septum is deviated or not. Now I'm going to ask Michael to identify some touches for me. So if Michael, you will close your eyes, and I want you to identify a sharp or dull touch.
Sharp. Sharp. Dull. Dull.
Okay. All right, Michael, I'm going to check your thyroid here. You can open your eyes. And this can be done right as you find your landmark. It's kind of like a butterfly at the cricoid, and you can feel from the back, having the patient to swallow, noting if you feel anything palpable. If you do, you can listen for bruise. You can also have them to drink a sip of water and watch them swallow and feel, or you can have them to slightly turn your head with a little bit of pressure, and this where you can feel when they swallow. You'll feel the thyroid move up and down. All right, Michael, push your hand towards my head with a little bit of resistance. Okay, the other way. Okay. Can you flex your head forward and back and turn lateral left to right? Okay? All right, Michael. Now I'm going to have you to put your hands in your lap, hands up, and at pronate. And I'm going to have you to identify a 2-point touch, and you're going to tell me if it's a single or double touch, okay? We're checking for nerves to be intact.
Single. Double. Single.
I want you to tell me if it's a sharp or dull.
Dull. Sharp. Sharp. Dull. Dull. Sharp.
Do they feel the same on each side, Michael?
Yes.
I'm going to go ahead and I'm going to check his hypoglossal, his vagus. I'm going to check out the tonsils, the soft palate, the hard palate, the posterior and anterior sides of the tonsils. This is my guy. This is my little stick here. We're going to have him to stick out your tongue and say ah. I'm going to check the gag reflex, looking at the uvula and tonsils. Again, noting any his hard palate and everything, noting any broken teeth, cavities, gingivitis. Michael, can you stick out your tongue for me? And now move it side to side. This is cranial nerve number 12. It is intact. We do have to have you check the reflexes, and we're going to do some hip flexion, extending of the knees. I know you won't be able to see the knees as well. So, Michael, push up against my knees, my hands, please. Okay, noting the flexion of the hips. I want you to, Michael, push out against my hands with your legs and push back. Okay, and at this time, I'm going to lift his foot so you can see me. I'm going to have him in a plantar flexion. I want him to not let me push his foot up. Ready? Okay, now if you'll flex it up, I want you to not let me push it down. All right. Now, I want you to hold your arms like this, and I want you to let me pull you. Pull them down. Okay. Hold your hands like this. Don't let me pull your hands down, and don't let me push them down. Okay. Now, I want you to let me keep me from pushing them up. Don't let me push them up. All right. Now, I want you to squeeze my hands. Okay. If I had the tuning fork, I would check his joints this time of his fingers and his toes, and I would wiggle the toes, and he would tell me if he could feel the vibration in the joints as well as in the. Michael, put your hands on your. And I want you to do a rapid movement for me, and he would do this bilaterally. All right. If you could see, I am going to do reflexes. I'm going to have Michael to just slightly let me bend your arm. Hold on, and we're going to do the bicep with my hammer. Sorry. Noting the muscular jumping. We do radial and ulna. Noting the jump fingers. Okay? Now I just want you to relax this arm, bend it for me, and we're going to do the truth. Okay? Relax. Michael, let's do the knees. And relax that knee and just let it dangle. Okay? Now we're going to let you just tighten that muscle a little bit and do the Achilles. And we would do this bilaterally. Michael, if I could get you to stand up for me and just extend your hands first for me. And let's just make sure that they don't fall. Now, I want you to just close your eyes for me. Michael, I want you to just put your arms to your side, close your eyes, and open them. And Michael, I want you to step over here for me. And for the purpose of this video, I'm going to move it so we can see him. And I'm going to have him to do some walking for me. Michael, I want you to first just walk towards me with your hands to your side. Okay, now walk back, and this time I want you to do heel to toe. One foot in front of the other. Okay, I want you to turn now, Michael, and walk on your tiptoes. Okay, now turn and walk on your heels. Okay, Michael. Thank you. And this will conclude our exam, our assessment for today. Thank you.